Distinguished guests, ministers, ladies and gentlemen. Thank you for the invitation to speak today. It's an honour and privilege to represent the members of Dementia Alliance International and the global community of now over 47 million people living with dementia. It is important that people with dementia, in the same way as people with any other disabilities, are included as equal partners in the conversations about them. This is our basic human right. Just a little bit about Dementia Alliance International for those of you who may not have heard of us. We've been in operation since January 1st, 2014, and in collaboration, yes, back to that word, collaboration, with Alzheimer's Disease International, Dementia Alliance International has become the peak body for people with dementia globally. And we're working together with the dementia working groups around the world. We also advocated to have a person with dementia invited to the World Dementia Council, possibly in Australian terms, what might have been called an ear-bashing Dr. Gillings, so thank you for putting up with us when you visited us in Australia. But it is spectacular that Hilary Doxford is now a member of the World Dementia Council, and we're very proud that she's representing people with dementia, and we welcome and appreciate the significance of that appointment. I believe the People's Perspectives session yesterday afternoon in many ways also set the scene for people with dementia and this conference, because our lived experience is as important as finding a cure. And although I won't share very much of my personal story, I have been a family carer for a number of family and very close friends with dementia who've now passed away. And I also am a care recipient of services for people with dementia because I have a diagnosis myself. So to say I have a vested interest in dementia is possibly an understatement. We also applaud the World Health Organization for holding this very important and significant conference, the work of the World Dementia Council so far, as well as Alzheimer's Disease International and everybody in attendance both yesterday and today. Thank you. Like you, we implore governments to invest more money into research. Dementia is currently at the bottom of the money pot, and we do need a lot more money for research. And as a number of people said yesterday, money spent now will save money later on. But we would hope that there is a more balanced focus in research, not only for the one that's after the golden egg, the cure. Of course we all want a cure, who wouldn't? But we do want research money spent on enabling people to live better lives with dementia, for better services, for better treatment, for better care. The discussions yesterday were extremely interesting and illuminating and of great interest to people with dementia. I found it interesting that there wasn't any mention of rehabilitation for people with dementia. Alzheimer's disease have a global charter. I can live well with dementia. I'm one of those people working very hard to live well with dementia. And I think that for that to have any traction in the world, people with dementia, we must all include this in our goal. We all must think about how to help people, how to enable people and empower people to live better with dementia. I think it was Alistair Burns said yesterday, we've probably all got a lot of things that we'd like to bring to the table, but he asked us to focus them down to 2 or 3. So the 3 that I've chosen in collaboration with membership of Dementia Alliance International is 1, that we have a human right to a more ethical pathway of care, being treated with the same human rights as everyone else under the Disabilities Discrimination Acts and the UN Convention on the Rights of Persons with Disabilities. And 3, that research does not only focus on a cure, but on our pre- and post-diagnostic care and on pre- and post-vention, including rehab. Just to explain a bit more, when I was diagnosed with dementia, I was 49 years old, mother of 2 teenage children. I was told to get my end-of-life affairs in order, to give up work, to give up study, and to get acquainted with aged care. I term this prescribed disengagement, and I found it unpalatable. And looking back at it, I have a background in nursing as well. Looking back at it, I also find it unethical, that we can have fantastic pathways of care for people who, for example, have had a stroke, and we have in Australia 175-page national guidelines for how to provide post-diagnostic support and management of people with dementia, and yet we only have a few help sheets for people with dementia. So with a nursing hat on, I find that is actually unethical, and we need to offer a lot more for people with dementia. We need to offer non-pharmacological interventions. We don't have a cure yet, we all know that. And as you were saying, we aren't that much closer to a cure. So to find other ways to support people with dementia to live well for longer is imperative, not only for our well-being, but for governments and our healthcare systems. So we need psychosocial interventions, and we need research into these things. If I'd had a stroke at the age of 49, I would have been rehabilitated and sent back to work in the best way possible. Having a diagnosis of dementia meant I lost my pre-diagnosis life. So I don't think that's an appropriate pathway of care for people with dementia. And it's very clear to me now that I could have easily stayed at work. I could have easily been paying taxes to the Australian government if I'd been supported with disability support to remain employed. I'm pleased to be part of a dementia working group led by Professor Alastair Burns, ITROM, which I can't remember what the acronym stands for, but it's on international standards for people with dementia and the care of people with dementia, and I'm really hoping that we can have rehabilitation into those guidelines. It may not be a cure, but it will ensure that we have a better quality of life. And I do believe that ultimately research will emerge to prove that it can slow down the progression of dementia. There was some research launched in Australia just this week that seems to have proven that it is possible to prevent dementia with lifestyle changes. And I certainly know a lot of people with dementia who have changed lifestyles, who have engaged in exercise programs and change in nutrition, and certainly seem to have slowed the progression down. So it may be anecdotal for now, but it definitely needs to be investigated. So new sustainable models of care that balance the role of family and government, that overcome gender inequities and that support our disabilities are urgently needed. Advances in information and communication technology, assistive devices, medical diagnostics and other interventions also offer much promise, and it's fantastic that the World Dementia Council also has assistive technology on the agenda. I use a lot of assistive technology to get through my day. Yes, I do want a cure, of course I do, but more importantly, I want a better quality of life for the 47.5 million people currently living with dementia. It's disappointing living in one of the richest Western countries in the world that in fact good care is still the exception and not the norm. And I'd like that to change. And people with dementia also need to be at the heart of the conversations in the same way every other community has stood up for themselves. Dr. Gilling suggested in Australia that perhaps people with dementia need to take to the streets with placards in the same way the gay and disabled communities did 30 years ago. We may not be doing that in front of Parliament houses, but we are doing that online, and we are working hard to have a voice, and it's exceptional to be here today. And we certainly do know that people are living longer and longer lives, but are we experiencing just extended periods of morbidity? And certainly if we live longer and that means just more people get dementia, then that's not an exceptionally good result. It is our human right not only to person-centred care and ethical care plans, which currently are not offered until we need palliation, and sometimes not even then, depending on the age of the patient, but to a system and world that stops discriminating and stigmatising us. The current system of care is unpalatable, in my opinion, and unethical, and people with dementia deserve much more. Thank you.
Thank you very much to 4 of our speakers in the opening session. You have spoken not only from the authority that you have, but from the heart, and that is very much appreciated. Thank you very much for being with us and giving us some thoughts, but also some inspirations.